So what is infection control? First of all, we have to know it. Infection control basically prevent or stop to the spread of infection in healthcare setting. So in this short note, we are going through about the infection, an overview of how infection spread and way to prevent the spread of infection. The first keyword is called standard precursor, or we can say universal precursor. So universal precursor are used for the care of all client to prevent the direct contact with all body fluid. Standard precursor routinely practiced by healthcare provider, including, so universal or standard precursor include what? It includes hand washing and or wear the gloves. So always hand wash or wear the gloves. Do these things no matter what. Before give a care to the patient, and after finish the give a care, we have to wash our hand. By simply washing hand, we can prevent 95% infection. When in contact with all of the body fluid, be sure to wash the hand after removing the glove. Sometimes NCLEX board asks, how long wash hand? Answer is 15 to 20 seconds. So use the masks, eye protection or face shade if the thread of any spread of the elements. That times we also use the more protection. But in this portion, we are going to only universal precursor, hand wash, wear the gloves, or no body sharing, or disposable things like toothbrush, comb, blood pressure cuff, right? The example of standard precursor are like urethritis secondary to chlamydia infection. In this table, we are going to discuss what are the airborne precursor, droplet precursor, and contact precursor. Before to go the precursor, I want to explain what are the different airborne, droplet, or contact precursor disease. The airborne disease are measles, varicella, tuberculosis, severe acute respiratory distress syndrome, shortly called SARS, smallpox, or H1N1. So these are the example of airborne precursor. So in case of airborne precursor, it is good if we wear all kind of personal protective equipment, right? Airborne precursor it is good if we wear the respiratory masks, especially N95 masks. And negative pressure, also private room. So when we cohorting the patient, it is good give the patient private room with negative airflow, right? Also, patient wear the surgical masks during the transport. Like the patient diagnosed by tuberculosis, and tuberculosis is a airborne disease, and patient need to transfer radiology department for chest x-ray. That times patient must wear the surgical masks. And also, without any reason, better not to leave the patient room. Limited transport, right? So NCLEX board, if asked, which one is a example of airborne disease? Answer is measles, tuberculosis, varicella, or SARS, smallpox, or also H1N1. So do I need to open the door or I should close the door if airborne precursor? So door should be closed all the time. In case of droplet or contact precursor, we do not need to close the door. Another important question NCLEX board asks about the cohorting, right? Or what room for what patient. Infection control should be notified every time a patient with a communicable disease is seen and not admitted. Also, do not cohort the post-operative patient with anyone experiencing nausea, vomiting, diarrhea, or open wound, or chest drain or infection. We call cohorting. Which patient can share with what patient? So when cohorting the patient, always it is good to put similar precursor together. Like if patient need to share the room, it is good contact precursor will share the room another contact precursor. Like a patient is diagnosed by MRSA, another MRSA better to share the room. Like a patient have a pneumonia, another pneumonia can share the room. So never put a clean patient with a dirty patient. What does it mean? The clear patient or dirty patient? Clear patient means imagine a patient came to the hospital for hypertension. A patient came to the hospital for diabetic, or a patient got hospitalized because of broken legs or pancreatitis. It is the clean patient. Dirty patient means a patient is diagnosed by MRSA with herpes or both, or a patient has a pneumonia infection, or a patient has flu. A patient has a nausea, vomiting, diarrhea, open wound. We do not know what are the underlying cause of diarrhea or vomiting. Maybe Sigel or sigallosis, it is an infection. Why I give them another patient who is came to the hospital because of hypertension? It is very important. Now, let me go the droplet precursor. So example of the droplet precursor are meningitis, bacterial pneumonia, epiglottitis, or pertussis. Pertussis, other call is whooping cough, or mumps, rubella, Haemophilus influenza type B, or group A streptococcus, and diphtheria, but pharyngeal diphtheria. So the person who diagnosed by droplet precursor, they must follow the universal precursor with they wear the masks, they should wear the goggles, and also face shade. Droplet precursor, most of them communicable. So when you give the service to the patient, it is better to keep a distance at least 3 feet. So how many feet you have to follow during feeding your patient? Like 3 feet, right? What about the door open or close? You can open the door. You do not need to close the door like Airborne. So what are the precursor? Surgical marks if you give the service within 3 feet. Private room like Airborne. Patient wear surgical masks during transport, and also limited transport. What are the example of droplet? Pneumonia, influenza, meningitis, rubella, right? Contact precursor. So the example of contact precursor, Clostridium deficit, herpes simplex virus, Klebsiella pneumoniae, MRSA, BRE, RSV, rotavirus, herpes zoster, infected pressure ulcer, or major skin wound, burn infection, or any kind of cowpox it is, and is it chicken pox. So any kind of cutaneous infection or skin infection, always contact precursor, like impetigo, pediculosis, scabies, varicella, or diphtheria. So you see the diphtheria is contact precursor and droplet both. But diphtheria pharyngeal or pharyngeal diphtheria is a droplet. But diphtheria when cutaneous, this is contact precursor. Ebola. Ebola causes viral hemorrhagic fever or viral conjunctivitis. All is the contact precursor. So if our patient is diagnosed by the contact precursor, what we should do, right? So contact precursor must follow the universal precursor or standard precursor. What does it mean, standard precursor? Simply washing hand with the gloves. So contact precursor must follow universal precursor with the ground. You see, gloves and gown, private room. Remove the gloves and gown before leave the room. So any virus or bacteria causes diarrhea, it would be contact precursor. Okay, so any infection causes the skin infection, contact precursor. Most common example NCLEX board asks MRSA, VRE, or RSV, roseola, Shigella, or shigellosis. Everything is a contact precursor. If your patient is under contact precursor, should the door be open or closed? Yes, we can open the door, right? If NCLEX board asks you question like HIV, what kind of precursor we need? Standard precursor. HIV can transmitted by blood or body fluid. We need to follow the universal precursor. Like vaginal yeast infection, standard precursor or universal precursor. Diarrhea. Diarrhea, is it transmitted to me when I give the service to the patient? Definitely no. Universal precursor is enough. So protect myself by hand washing, wear the gloves. So hepatitis B or hepatitis C. So they spread out through the body fluid or blood. Standard or universal precursor is more than enough. MRSA, it is Staphylococcus infection, skin to skin infection, possible to transmit. So contact precursor. Clostridium deficit, contact precursor. They can cause diarrhea as well. Rotavirus causes diarrhea, contact precursor. Shigellosis or Shigel causes diarrhea, contact precursor. Or we said pediculosis, right? So you see, pediculosis or head lice. Can it give it to the others? Answer is yes. Contact precursor. Like flu, you know, the flu is most common. Or epiglottitis, it is droplet precursor. NCLEX board asks, this is the flu. What kind of precursor we need to follow? Droplet. They can cause epiglottitis. You see the epiglottitis? Influenza, seasonal, droplet. Rubella, droplet. Whooping cough, we call pertussis, droplet. Meningitis can possible to spread through the saliva or sputum. It is droplet. So when we give this healthcare provider or health services have to stay at least 3 feet. Like chickenpox or varicella, airborne. Monkeypox, airborne. Or rubiola, it is airborne. So you see measles, other name is called rubiola. But here we call rubella. So don't miss these two. But cohorting is very important for NCLEX board exam.